I think I just want to add one thing. One of my mentors in this work is former State Senator Jim Leddy, and Jim would always say, and still does, that all healthcare is personal. So I think I just want to tell my own little personal story here. I'm a cancer survivor, and I spent too many hours, I'm told, in Jennifer's recovery room.
I never said that.
And I think the point, other than knowing that every person in this room has a story, and in many cases it's worked fabulously well, and in mine it worked terrifically. As we move up the ladder, as the speaker said, as we continue this, we need to do it. We need to do it as fast as we can. We just wrote up on the board of my committee this morning, sooner, faster. But we also need to do it in a way that makes sure that Jen and Sue and all of their colleagues are there for us when we need them. We need to keep our hospitals and our docs and our other folks viable and going, and change is difficult sometimes. So it's taken longer. We've been at this for a while. It's taken longer than any of us would have liked, and my guess is it'll take longer still than we would like. But thank you for your help in that, and thank you for your offer to keep helping us as we go along here. It's going to be difficult to connect these goals that we all agree with how we actually make it work here in Vermont for us, and make sure that our providers are there when we need them to be.
I talked to a lot of people. I participated in the forums as well, and it's really, really obvious to me, as it is to all of you, that despite our best efforts, the system is indeed broken. And some of the numbers are displayed up here on the signs that people are holding. There's still uninsured Vermonters. There are a lot of underinsured Vermonters. There are a lot of underinsured Vermonters who don't even know it yet because they haven't had to take advantage or to use their health care plans. And then they find out that their plans aren't as good as they thought they were. And those folks are out there, and we're hearing from a lot of them. We also know that costs are bankrupting this system. When we look at the budget problems we're facing in this building, a lot of it's caused by rising healthcare costs. And when we look at what's happening nationally, we're up to 18% gross national product in healthcare costs, and we have got to do something to change that system because it is not working for Vermonters. It's not working for Americans at all. We are committed. And Steve Maier's committee have made is we're going to move this discussion forward. We're going to stop talking about whether it's a good idea or a bad idea. We're going to start talking about what the questions are, what the concerns are. We're going to answer those questions, and we're going to try to design a system which will get us to our goal of universal coverage of all Vermonters at an affordable cost. It's not that I look at all of you as partners in this discussion, not only to talk to your friends and neighbors, to deliver the postcards, which are pretty powerful and compelling, but also to help us work through the details of how this system would operate, and how we go to Washington and ask our congressional delegation and ask our president to give us the waivers that we need. Let's start talking about what a better system would look like. You know, we can do it here in Vermont. Vermont's shown the way on a lot of different issues. And I think we can show the way on health care, that there is a better way. And the federal government's going to look at us and say, hey, those guys have got a good idea. Maybe we should look at how they did it, and maybe we should do this for the whole country. We can do it. This year, and we're going to make progress this year. We can get there in Vermont. I hope we'll see all of you next Tuesday evening. Our two committees, Steve's committee and my committee, are having a public hearing, and I want to thank James Haslam, where do you go, right here. say yes immediately, but I said yes because I realize it's a good idea. People need to be heard. And after sitting in the forum, I recognize that people have stories to tell, and we need to hear them. And that's the starting point for a longer discussion. So thank you again for being here, and let's see what we can do in Vermont.